Hello, ladies and gentlemen. Welcome to Triple N Media. I am Dr. NIK NIKAM, a cardiologist. In this presentation, we are going to look at elevated left heart pressure by 2D echo and Doppler studies. This is based on the book which I have written with the title Echocardiography and Doppler Reference Guide, more than 400 pages of very precise, concise notes on echocardiographic measurements, normal and abnormal findings, and what are all the different things we need to look for when we are doing a patient echo or Doppler, for example, with aortic stenosis or left heart failure or cardiomyopathy. So let us begin with the feature presentation. When we are looking at elevated left heart pressure using 2D echo and Doppler studies, there are a number of parameters we can measure and combine these parameters to determine if this patient has diastolic dysfunction, elevated left heart pressure, or even elevated right heart pressure. All of these things sort of go hand in hand in patients with heart failure, hypertrophic cardiomyopathy, or cardiomyopathies of infiltrative nature. Some of the things we're going to focus upon will be the main focus will be on the mitral pulse Doppler. We're going to look at the E wave, the A wave. We're going to look at the E to E prime ratio by looking at the tissue Doppler studies, the E to A ratio from the mitral pulse Doppler, mitral deceleration time, which is an important factor to determine the diastolic dysfunction or relaxation, mitral velocity with low ejection fractions, left atrial size, tricuspid regurgitation, pulmonary vein systolic diastolic ratio reversal, IVC compression ratio, and many other different parameters. So let's look at some of these parameters and see. The first thing we look at is mitral inflow pattern. If the mitral is the E wave, then we have the atrial kick. This is the early filling. This is the atrial kick. If the E wave is greater than If the E to A ratio is greater than 2, and the deceleration time, that is the time from the time it reaches the peak and reaches the baseline, is less than 150 milliseconds, then it suggests elevated left ventricular end-diastolic pressure or left atrial pressure. Similarly, we look at the mitral annular tissue Doppler. There are various different waves which we need to be familiar with. S wave is caused by the systolic motion of the mitral annulus during systole. E wave is related to the early left ventricular filling, and A wave is sort of related to the atrial kick. And this mitral annular velocity sort of mirror images the pulse Doppler of mitral valve itself at its tips. And these are designated with lowercase letters with an apostrophe. That's something to keep in mind, because when we do the E to E prime ratio, that's what we are looking at. Now, mitral E velocity in patients with heart failure. If you have a patient with heart failure, the mitral velocity will be very low. But if it's greater than 50 centimeters per second in patients with low ejection fraction, like less than 30%, it may suggest elevated left ventricular filling pressure. And left ventricular velocity time integral is also used to measure the stroke volume and cardiac output, which may give an indication as to the left ventricular overall systolic function. Now let's look at the left atrial volume index. Left atrial volume is measured by outlining the perimeter of the left atrium, and it puts these discs, and from this the computer calculates the left atrial volume. The normal left atrial volume should be less than 34 ml per meter square, and anything more than that is suggestive of left atrial enlargement. Left atrial enlargement is an important part of determining the presence of diastolic dysfunction and also elevated left ventricular end diastolic pressure. These two are different parameters, diastolic dysfunction and elevated left atrial pressure. You can have diastolic dysfunction without having any evidence of elevated left atrial pressure. The third parameter we look at is the tricuspid regurgitation velocity. If the tricuspid regurgitation velocity is greater than 2.8 meters per second, that is suggestive of moderate mitral regurgitation, and it's an indirect indication of elevated left atrial and left ventricular pressure. Similarly, the inferior vena cava, if it's greater than 2.1 centimeters and the compression is less than 50%, it suggests elevated right atrial pressure, which may in turn be related to elevated left atrial pressure in patients with congestive heart failure, unless they have primary pulmonary hypertension, which may be causing elevated primarily the right heart pressures. Then we have the pulmonary vein flow. Pulmonary vein has similar waves. We have the systolic wave and we have the diastolic wave. Generally, the systolic is bigger than the diastolic wave, as you can see here. But in patients with elevated left atrial pressure, the diastolic wave will be bigger than the S wave. And if this ratio is less than 1, it is suggestive of elevated left ventricular filling pressure. Similarly, if the IVRT, that is isovolumic relaxation time, is less than 60 milliseconds, it also suggests elevated left ventricular filling pressure. Now, sort of putting these pieces together, if we have an E to E prime of greater than 14, we have a tricuspid velocity of 2.8 meters per second, or a left atrial volume index of greater than 34 ml, that is suggestive of elevated left ventricular and diastolic pressure and left atrial pressure. Even if you have two of these parameters, it is suggestive of elevated left atrial pressure. And here's an example showing that if E prime is greater than 14, if the two criteria, if you have less than two criteria, it's normal left atrial pressure. If you have two criteria with a tricuspid velocity of 2.8, it's sort of inconclusive, but if you have 2 out of 3 criteria, left atrial volume of greater than 34 and tricuspid regurgitation and E to E prime ratio, then it is suggestive of left atrial elevated pressure. So ladies and gentlemen, in summary, mitral, if the ratio E to E prime ratio is greater than 14, mitral E to A ratio is greater than 2.0, mitral deceleration time is less than 150 milliseconds, mitral velocity is greater than 50 centimeters per second in patients with low ejection fraction. If the left atrial size is greater than 34 ml per meter square, if you have a tricuspid regurgitation greater than 2.8, then in the inferior vena cava, if we have 2 or 3 of these parameters, then the patient has elevated left atrial pressure. So you have been listening to the presentation on elevated left heart pressure by 2D echo and Doppler studies. I am Dr. NIK NIKAM. Thank you so much for watching this presentation, and please do check out our book on Amazon.com, which has chock full of information, ready information on any particular topic as far as normals, abnormals, and what are the conditions associated with the echocardiographic findings, and you will like it. Thank you so much. I will see you in the next presentation.